I think as women, we have a strong desire to nurture, care, and love. And if our job isn't doing that, or our career, or our lifestyle isn't doing that in some fashion, I think we're always wondering, what am I missing? And I think that's what it is we just have this thread through us that we have to give. And when we give, we always receive. And I hope that most people, like a lot of women, are like, oh, I don't deserve that. Keep the reception open for yourself because that's how abundance happens.
Thank you for tuning into Time for You Evolve for female entrepreneurs. Remember, you have what it takes to achieve greatness. Your time is now. You're here with me, you're ready to change lives, and you're ready to change the world. Isn't it time to skip over the confusion and start creating sustainable and consistent results? We're going to pull back the curtain and start giving meaning to life in this podcast. Time for You Evolved. Hey, my name is Lisa Carmichael, and I am obsessed with everything online. It's no secret in this crowded and highly competitive business world, we need to stand out. It's even more important at a deeper level to stand up for ourselves. I am a farm girl who grew up shy with zero confidence. If someone had suggested that I would eventually start a podcast, I would never have believed it. As a farm kid, I had the unique opportunity to embrace a holistic approach to life. All the seasons of growth were lessons that have helped me and other female entrepreneurs find success when they've been stuck and struggling. The Time for You Evolve podcast is here to help you navigate business online so you can be laser focused and help you navigate the messy and the magical in every season of your business. Pull up a seat to hear the tried and true secrets that other female entrepreneurs like you are facing and get ready for real talk while you learn. This is the Time for You Evolved podcast. Hey there, entrepreneurs, ready to work smarter, not harder? Then you're in for a treat. Let's talk about video marketing, the smart approach that attracts, retains, and converts faster than any other strategy out there. Hey, I get it. Video marketing can be daunting. You should be doing it, but you're not quite ready to take that leap, or you're frustrated because you're not looking like a pro. Hey, I get it. Who can blame you? Creating videos can be frustrating, time-consuming, and downright intimidating. That's where BigVu comes in. It's the solution for your frustration. With BigVu, you can create professional videos with ease thanks to its teleprompter app. I've been using BigVu for years. Did you know that? BigVu is an app that has saved me a lot of time and hassle. The app makes it easy to create professional looking videos. It's an online teleprompter that allows the presenter to keep eye contact with the camera while reading the text they need to speak. Using a teleprompter app allows the reader to sound natural without cue cards or notes to fumble or looking down while you're speaking. And the best part is that BigVu allows you to focus on your performance and delivery so your confidence shines through. You get to keep eye contact with the camera while you're reading your script. Whether you're a marketer, a blogger, a trainer, a freelancer, a publisher, or business owner, BigVu is designed with you in mind. If you're ready to take your video marketing game to the next level, click on the BigVu link on my website, lisarcarmichael.com/BigVu. Join me and be the best presenter you can be and learn how to make great presentations. And that's lisarcarmichael.com/BigVu. So hey everyone, today I'm excited to introduce you to Amy Nielsen. She's a Minnesota gal and has a passion for healthcare and helping people. Amy is the brains behind lifestyleadvisors.com, where she works with individuals, small businesses, and the self-employed to navigate health insurance, save money, and improve their overall health.
Her journey began back in 2014 when she became a licensed securities representative and an insurance agent. And she realized that no one was addressing the rising costs of medical care and premiums. So she decided to step in and create better options for people. And that's not all. Outside of work, Amy is a Toastmaster, a dog owner, and a proud mom of four. She has a beautiful family. She's also into homeopathy and loves exploring ways to keep the body running at its best. I know you're going to love this conversation today. Amy has so much insight and so much heart to share. So let's get started. Amy, welcome to the podcast. What really inspired you?
Well, most people don't even understand the current plan that they have. So I always like to begin there, find out if there are medical needs, and find out what the real risk is. Because most people, I think, have health coverage because everybody has health coverage without really understanding what they're paying for. And when they do need care, what is the best beginning, middle, and end for that experience. So just basically starting at what people's understanding is, and then just move on from there. What is the risk, doctors, medicines, and see where we go.
Was there a moment or an experience that pushed you into action?
Yes. As a matter of fact, when we were told, okay, well, we're putting health planning into the budget, what is that number? And then you send your client out to find out, and they come back with, any number of possibilities, high deductible plan or a gold plan. It's always expensive if you don't understand what we're really covering. So it could be almost as much as a small mortgage on a cabin when you get individuals over the age of 60. But there are other strategies to overcome that. Otherwise, you're just basically going to pay what the individual market has to offer or whatever the group plan has to offer. So there's not a lot of creativity, what I found. And so the financial planner or advisor is kind of relying on that person or the client to come back and say, well, this is what I found, without even knowing if this is really good for the planning, because then we also have long-term care, life insurance, and those products can also be used when you really investigate what is the health risk that you want to cover, versus just slapping health insurance because that's what everybody does without really understanding if it's accomplishing the goal. And it is expensive if you don't know what you're doing.
So, what are the biggest misconceptions people have about health insurance, and how do you help them navigate those challenges?
Misconceptions that insurance will cover everything or they will cover you at Mayo Clinic, or so there's some nuances that I'm learning and observing all the time. I certainly don't have all of the answers, but what I do share is the experience that I see others having and how we overcome those obstacles so that we can avoid them in the future, or if it comes upon you, how to navigate that. And for example, on the open market for individual medical coverage is very regionally based. If you have an employer group plan, your area for coverage expands quite a bit. And so that's something to keep in mind, especially if you're having treatment outside of your region, how to accomplish that. Usually a doctor's note or some special permission would be required for those types of plans. So those things that people assume about their insurance coverage isn't necessarily the case. And when you go to look at the contract that you sign, the evidence of coverage, it could be more than 200 pages. So it's really a good idea to just peruse that and then also understand where you would go for help and what the hospitals are so that you don't get a surprise bill. And by the way, if you do get something out of network, I would always be skeptical of bills. just be very aware of if someone tells you to pay something, that's not necessarily true.
I've seen that happen myself personally, so that is good advice.
Mhm.
Coming from a marketing perspective, who is your ideal client? Who is it that you love to help?
I love to help those that are wanting to bridge the gap to Medicare. They want to leave their job, but they feel like they have to stay there because of the health coverage and the other benefits. That is a really satisfying experience to show people how they can retire early and get even better coverage than they currently have, in my opinion, when you know how it works. Another one is people who I really don't benefit from because I'm paid by the carriers that I represent. At no time am I charging anyone unless I needed to write something really elaborate. But another demographic that I like to help, and that is the low income or those that qualify for Minnesota Care. They feel like they're having medical issues, they don't make enough money, and it's very, very scary and sad for them. And so that's really helpful to help walk them through the MNsure process, calm them down. And then once they get into the county, then I probably usually don't ever hear from them again, and unless their income changes and things go the other direction. But just helping people get rid of the fear and the doubt, that is really gratifying because there should really be no fear and doubt with this. We have a lot more power over these situations, and that's what I like to remind people of also, that you can just change your state by smiling.
Well, I think that it can be overwhelming because it's not the typical type of paperwork that we look at on a regular basis. So you as the expert, you understand the jargon, you understand the forms that need to be submitted and the different types of deadlines that are out there. You were talking about like working with the county. Are you talking about maybe social workers?
Yeah, so how that works is we go through the MNsure.org website, put in their demographic information, age, county, and then their gross estimated income for the coming year or whatever it happens to be, because you can apply for medical assistance any time of year if your income allows it, within 63 days, something like that. But anyway, so we go out to the MNsure website, and then what happens is I get a notification that says this person qualifies for Minnesota Care, and then it shoots to the county, and then I'm out of it. There's nothing else I do except for find out if they qualify for a premium tax credit, which is a state funded discount for health insurance, or if your income is so low, the state is just going to pay for your medical coverage. You're not going to pay anything. And then that goes through the county's social services.
I'm glad that you're doing that because when you're overwhelmed and that paperwork, you're looking at it and you just don't understand what to do with it or how to fill out the forms, and it really is straightforward. It's just answering the questions,
Mhm.
but it can be overwhelming, especially when we're talking about the number of mental health cases that we have here in the state of Minnesota. And are you seeing that affecting, or are there different types of policies that would make sense more so for someone versus some other type of assistance?
Sure. Well, what I'm finding now is mental health is a part of most plans, especially the alternative plans that offer a MEC or a minimum essential coverage. Usually always have some type of telemental health. It might not be your choice in provider, but it is someone that you can frequently contact. If you need that, a lot of plans will just automatically include that. There are some inpatient or um, in person, and that's usually a copay visit for that type of thing. But yeah, mental health is definitely, people are asking for it, especially Those who provide mental health, they all have mental health included in their plans because, yeah, it's a stressful job, I'm sure.
So you have been doing this for several years now. So what changes have you noticed that you're excited about?
Changes that I've noticed that I'm excited about. I guess I get excited when people say, wait a minute, this health plan I have or this health premium is really expensive for what I'm not using it for. I'm spending a lot of money. I go once a year. Is there something else? And people who are willing to take that risk. A really good connection for me is CPAs and financial advisors. As a matter of fact, earlier today, I had a call and they're like, okay, my husband's ready to retire January 1st. And I said, okay, what is it going to be? Is it going to be health insurance or are you going to do the alternative? And we've had these conversations in the past to get them ready for it, right? So they're doing the alternative. I said, great. If you have any questions, let me know. Didn't trust me on this. This is going to, when they're like, we're going to trust you, Amy, on this. I said, okay, just make sure you follow the rules, just like you would a contract, right? But they're member guidelines. So really helping people be really proud of their decision to manage their own health and pay for usage and not just be a medical express card or but there are individuals that have type 2 diabetes, they have chronic, they have issues, and insurance products are perfect for those people, mainly because it gives them the peace of mind. So whatever we can do to make that person happy or get them into a homeostasis, that's just going to also improve their health when they're not worried about what's going to happen when a sick thing or an illness, injury, accident, diagnosis occurs. They have a peace of mind. So that goes a long way.
Hmm.
Yeah.
And female entrepreneurs is the audience that we have listening in today. And do you, as someone that might be retiring and looking at like what type of insurance would I have if I'm self-employed and let's say your age, retirement age, 65. What what then?
Mhm. I'd like to encourage people to find a doctor or practitioner that they know, like, and trust, and not get a health plan that covers, that particular. Find someone that you know, like, and trust, that regardless of the plan you're on, you can continue to see them. Because what I have found in some plans, when you, like, say, get a Blue Cross plan, when you start going to all of those doctors, they're really not found in some of those other plans, unless in other carriers, unless you go to the gold or silver plan. So choosing your um, and the type of care you want. When something goes wrong, who do you want helping you? Do you want someone at a line of clinic, or do you want a functional or integrative? What works for you? And there's just a wide range of options out there nowadays. A lot of people like to use chiropractors. And then if there's a major medical event, well, that's kind of what you more or less use your insurance for. It's like that unforeseen thing. But when it comes to your day to day care, your insurance plan is going to make you go to, say, M Health Fairview, versus if you're doing some of those alternatives. Again, you have that relationship with a hopefully an independent practitioner that you can see regardless. And then once you hit that age 65 and you're on Medicare, you can continue to see that person, especially if you have Medicare Original. So much more flexible. It's better for the providers if you have Medicare Original with a supplement than if you have an Advantage plan. They don't get paid very much, and there's a lot more freedom. And I can show you really reasonable a supplement. Usually they start at 200, but there's a couple of good ones, high deductibles, that are well under $100. So again, it all comes down to finding that person and make them your doctor. Have a relationship. and don't let, the insurance products drive who you see, because they might not always be there. Um, your insurance plan may not cover them 1 year. It's just you set yourself free when you do that. So.
Gotcha. That makes sense. So let's take a step back for just a moment. Again, the audience here are female entrepreneurs. So, what was that driving force that made you realize that you wanted to start your own business?
Oh, right. Because I just never made it as corporate very long. 2 years max. Let's see. I started off in electronic engineering back in the 80s and ended up as a systems engineer, which is basically a glorified um, coder. And this was back in the day when we went from mainframe. So I was doing mainframe to client server to now what is the internet, I suppose. I sent my first email in 1991. And I realized quickly that you know, 2 years in a cubicle. And then I went on to become a sales engineer. So at least I got out of the office, and then I would install software in testing environments. That was a lot of fun. But I wasn't really helping anybody. And I think as women, we have a strong desire to nurture, care, and love. And if our job isn't doing that, or our career or our lifestyle isn't doing that in some fashion, I think we're always wondering, what am I missing? And I think that's what it is we just have this thread through us that we have to give. And when we give, we always receive. And I hope that most people, like a lot of women, are like, oh, I don't deserve that. Keep the reception open for yourself, because that's how abundance happens. I'm learning that myself. So often we're like, oh, no, I just love to help people. But, it's a two-way street. So we do it for a reason, and it's not always monetary. I think we're not real monetary driven as we are freedom, and expression driven. And so I think I can really do that with people understanding their health needs, taking the fear out of the risk, and just saying, look, if you get a bill, you don't necessarily have to pay that. Ask questions, make sure you understand the things that are happening to you. And so that is my driving factors. And I feel like I'm giving and caring enough to hopefully earn a living.
Well, I think that's what we all want. We want that positive ROI. And do you feel like you're beating the streets, or is it something, having your own business, is it something that just kind of comes naturally to you now?
Definitely more natural. And what they say when you go into financial services or even insurance, when you become an agent or an independent broker agent, the first 5 years are critical in building your business and making the phone calls and that type of thing. But as of late, I've more been relying on imagining what I want in a client base and who I want to attract. I want to attract more small business owners that are just finding they can finally start offering health coverage. But what's out there isn't as great, because their people could potentially take advantage of that premium tax credit and get a lower help. But now the employer's having to pay the half of that. So we're missing that premium tax credit that could be yielded. And so there's some things in there. And so that's who I want to help right now. So I'm envisioning those people, the law of attraction, those people that need that help we'll find our ways to each other. Yeah, that's my magical answer.
As a parent and a business owner and a healthcare advocate, how do you balance it all while staying connected to that passion of helping others?
Well, my kids are older now, which is great. My daughter, of the four, my youngest is 17. She's a senior. So the more, every year the freedom becomes more and more. And then, of course, your business, I don't want to say necessarily drives itself, but when I get a phone call or a lead or a referral, definitely those are my highest priority. I could do a better job of hitting the streets and helping people that way, but I more or less I like to connect with others because that's how we, I guess, grow. There's so many uh, opportunities with the people that we already know.
Well, and I think there's just different seasons of life as well as different seasons of business. So keeping that balance, it's not necessarily a perfect balance act because everything is always changing.
That's right. That's right. I've recently started a hobby in chemistry, or for the past almost 3 years now, I've been using chemistry on my body, and I'm starting to. Well, I really want to share it with others because it has made such a profound impact on myself and the research that I've done. I want to share with people who feel like things are hopeless or what are my other options for treatment. Because when I see what the medical industry has to offer, there are more options because the human body is an incredible machine. And and so I'm starting to do a little bit more of that than my insurance. And I would love to have help if there are other, especially women out there that want to do this type of thing. There's just really no one out there that takes the time to really look at, what are all my options? There's 25 different carriers I can show people, but it really just comes down to, do you want an insurance contract or do you want medical freedom? And then medical freedom, what does
Mm.
that look like? What feels good to you? Because there's all different kind of plans that can, satisfy that. Medical insurance is basically regional, unless you do some of those more captive products where you have to call a company and it's more agent relationship than a broker has access to. So there's those type of things also. So yeah, because there is no shortage on health coverage, and when you look at what's happening, people get worse and worse every year, and it's unfair and it's very suspect because the more medical coverage people go for, the worse they get. So I don't know.
So the chemistry part of it, is it kind of like a neuroscience, or is it you are what you eat, or what?
It is micro, wait, molecular medicine, biomolecular medicine. It's everything comes down to a charge. A positive charge is bad, that's radiation. A negative charge is electron is good. If someone has a disease, illness, situation going on, they have an excessive amount of protons somewhere in their body. The molecular medicine using simple salts can neutralize that positive charge using electron therapy, I'll call it. But it's basically structured water that you're drinking. Structured water is amazing. We're bioelectric plasma beings, right? We're charged water, basically. We're mostly charged water. And when there's a bad charge somewhere in your machine, we can correct it using protocols and other applications like the Biotron, which I happen to have right here. Oh, it's like a rife machine where you hold these paddles and it sends in a frequency and you just kind of sit there. There's also a plasmatron that you can actually sit in the room. Some of my colleagues have those. You could do a bed and breakfast. That's like if someone has Lyme's disease, because those are spirochetes that gets right into the cell, very, very difficult to get rid of. The Biotron can help along with the salts. The oxidative therapy I was telling you about, but the plasmatron really does the trick. So if someone is like, hey, is there some other options out there? I'm like, yes. How much research how much do you care about yourself? Because I'm not going to do the research for you, but if you do enough and see all of the testimonials, I will give you more than enough where you can talk to people, see what they're doing and how their experience has been with your condition or even worse. And but it really comes down to the individual to take charge of their body, because that is where the real results happen, not
For
relying on
sure.
someone in a white coat that thinks they know what they're doing, because it's truly an opinion and a practice, right? That's why you get a second opinion, and it's always called a practice, because if our bodies were exactly the same, we would all be dead from the same thing at the same time. So it doesn't work like that. It's really emotionally um, charged. Emotions have a lot to do with the organs that fail, which I think is super exciting. There's a woman called Louise Hay. I'm sure we've all heard of her.
Hmm.
She has an incredible book that you can look up an ailment and it will tell you kind of the affirmation, the thing that you're suffering from emotionally, and then the affirmation to overcome that, depending on what the organ in your body is. And I'm not saying that these things are 100%, but when you start looking at all of these things together, what you're doing is you're just really changing your mind, your state of mind. Emotional mastery, I think, is the key to longevity, not letting people bother you.
Hmm. Hmm. How long has this technology been out?
Since in the beginning, when in the beginning, and there was light, I would say, as long as you have consciousness, it's been existed. As long as, since Eve showed up. When Adam was by himself, all he was naming was the animals, and then Eve showed up, and yeah. Anyway, that's
Ah.
a funny antidote, but Adam did say she made me do it.
Okay, so you also, with being an entrepreneur, you've been in Toastmasters. Are you still in Toastmasters?
A little bit. I gotta find a group that gets together in person, because Toastmasters is really a one-to-one, person-to-person group setting, because that's when you're going to get the body language, and the handshaking and the whole etiquette of running a meeting and how to introduce people.
Hmm.
Being in that meeting setting is wonderful. So a lot of them are hybrids. Some people just decide to be just only online. So until I can find a group that meets mostly in person, I'll get back.
Well, and not only that, but something that meets with your busy schedule
Yeah.
or matches your schedule.
Yeah, you can go once a month, which I don't think that's enough. Once a week is pretty good, if you really are committed to improving your skills.
Well, if you could give any advice or one piece of advice to someone who is struggling to find a health plan that fits their lifestyle, what would that be?
Advice to find, well, I guess I would start with the worksheet. I have a worksheet on my website, and then understand the plan that you currently have, and then what is it that you don't like about that plan? What would you want to change? And then really understanding what kind of care you would like to receive, and then pay for that. So if that is going to, a particular clinic or a Blue Cross Blue Shield doctor, because that doctor knows you really well and they've been with you for years and years, that's what you should do. If you rarely ever go to the doctor, or maybe it's a kid coming off their parent plan, all they really need is just a teledoc and a catastrophic coverage, so that everybody is at ease, that if anything does happen, they can get care. Because what we don't want is people to not do anything and then wait till it's too late, when a problem has maybe gotten worse. So teledoc is a great place to start. Even if you have nothing else, you could spend under $100 to at least have access to virtual primary care, and then work your way up from there.
So, do you think some of these are just trends, or do you think this is here to stay and this is the way things are evolving?
Absolutely. As a matter of fact, on my website, under the resource directory, or no, shopping for health coverage, shopping. Anyway, you can shop dental, you can shop doctors who are cash providers. There's something called Join the Wedge, started by Twyla Brace. She's a healthcare freedom. On her website, you can find doctors who accept cash. So it is definitely here to stay because more people don't want to be they don't want to be profitized. It's bad enough that, Medicare, we're making money off seniors that way. But, if you're under 65, we pay even more than Medicare and we get less coverage. So people are waking up to say, I'm not going to do that anymore. So, yeah.
And if you had to offer a piece of advice to the younger Amy, what would that be?
Wow. Travel more,
Mm.
travel a lot more, and don't be afraid to go alone. And let's see, keep doing whatever it is that makes you curious.
That's
Just,
great advice.
yeah,
But
otherwise life is not interesting. I want to have a personally interesting experience, and you don't do that when you do the same thing. And like you said, change is what we do. If a plant didn't change, we'd have no vegetables.
that's true. So, do you have anything exciting coming up in the next weeks or before the end of the year or in the upcoming year?
Let's see, before the end of the year, a couple of girlfriends and I are going to Florida, and a couple of these ladies really need to get away, and they've never really gone out on a ladies adventure like this. So that's really exciting, being in the 50s. And I love connecting with people. You don't necessarily need to know somebody like 5 or 10 years. All you have to do is just connect on something you're interested in and have fun. Like I said, when you help people, life is a boomerang. I love the boomerang effect. As long as you send out good boomerangs, it's all good. And never get revenge. That's probably one thing I would always say. The universe always works itself out in exactly the right way. It's really not up to us to try to fix anything,
Hmm.
right? Just
Yeah.
imagine the best for you and yourself and others, and it usually always works out.
I think a lot of times we, especially as women, we just have a hard time just being. There's white space and we have to like jump in and do something with that time, or we have to take care of something instead of just embracing who we are and what we have.
I would just add, when you're looking at health coverage, medical insurance has a enrollment period, at the end of the year, like we're in right now, or a special enrollment. But when you look at these alternative health plans, you can start any time of year. Doesn't matter. There is no special enrollment for alternatives because, again, you're in charge, and you can start anytime. So we'll see.
That's good to know because so many times you feel like you only have that window, or you're told you only have this window. So, and it just depends if there's like a life-changing event or some other reason to start something different.
Exactly. A loss of employer coverage, moving to another, moving into here. Yeah. And then, like you said, life changing, a birth. It's really sad, and I haven't quite figured this out yet, but if a woman is pregnant, doesn't have insurance, she can't qualify for insurance until after the baby's born. So unless there's an income reason, the state can pay for it. But sometimes these women, there's like a gap in there for women who make too much, don't have insurance, and then they have to pay for the birth themselves, believe it or not,
So they're stuck paying that bill. Oh my
because they don't
goodness.
necessarily qualify, and they don't have a reason to get health insurance until the baby's born. So somehow
Mhm.
we're not helping expectant mothers, which I think that is a sad thing. And there are pregnancy resource centers out there that will, I believe, assist in that, but it's definitely an area that should be improved, especially by the medical establishment who makes so much money. There's definitely money left over because used to be a charitable organization, right? St. John's Hospital or whatever, and now it's become more profitizing.
Mm.
Yeah.
And how does that work? How do you work with Cobra? Like, let's say someone loses their job and they have that expensive Cobra coverage.
Right. So we've got a couple options. We compare the Cobra option. We can go out onto the MNsure website, see if their new income qualifies for a premium tax credit. Then we would provide that Cobra documentation to show that special enrollment period. They have technically 63 days if they don't take the Cobra to also get that medical coverage. Again, you have to show the loss of health coverage for that special period, but oftentimes it's cheaper, especially if they're going to get a discount on their own to not do the Cobra. Now, I did have a special case where there was this couple, it was already in December. We can't go back to December 1st. So they paid Cobra for December. We started health coverage in January because you can't go back with Cobra as long as you have no gaps in the coverage. It would just continue forward. So there are reasons that you may have to use Cobra for a month if you have office visits coming up.
Mm-hmm.
Yeah.
Why do you think Cobra is so expensive?
Well, the employer is no longer paying your half of the premium. And sometimes there's a company that has to do the transaction, like a third party that takes the money, then gives it to your employer, and they charge a fee, sometimes 2% up to. So that's where you could end up paying even higher than what the premium would be. But maybe, as I mentioned earlier, that person's going to Mayo, and if they go to an independent plan, they'll no longer be covered under that new plan. So again, we want to make sure, okay, if you're having a medical experience now, maybe it makes sense to keep you in your Cobra because you've already met your deductible, and this is going to be your cheapest route. Versus, it always kind of comes down to, what do you got going on?
Yeah. Well, and not to keep you, but what about the pre-existing conditions? Everyone was really stressed out about their pre-existing conditions and losing their insurance. Is there hope for someone that has a pre-existing condition?
Yeah, so that's a couple of different ways to answer that. Insurance doesn't, at least in all of the applications I've been doing, they don't ask for any medical history unless it's a Medicare supplement after their initial eligibility. They'll ask life insurance style medical questions, and you could be rated or denied for a Medicare supplement. But when it comes to under 65, the medical insurance doesn't ask those questions, but the alternatives want to know. So if you choose a membership health plan, there's a vesting period for that condition, and it can be a 12-month look back. If there was a diagnosis and treatment within the past 12 months, that could be pre-existing. Some companies go, or some memberships go far back as 36 months. Some go 48. Just depends on, what we're doing. Now, pre-existing that's not considered or not counted, that would be non-insulin diabetes, sleep apnea, high blood pressure, high cholesterol. Those things are usually managed through medications, and they don't usually result in a hospitalization or an expensive event. So pre-existing can have a vesting period for the alternative, or with medical insurance, they can't really ask that anymore. In some conditions like dialysis or chronic, then you become, you get a whole new health plan because, you need the medical system in order to exist. And so they have special plans for people like that.
So they're not completely cut off. There are options. There is hope.
There's always hope.
I love it. Okay. So listeners, I want you to go to Amy's website. It is lifestyle-advisors.com. And on the website, she has a worksheet. Do you want to just share just a little bit about that real quick before we
Sure.
leave today?
Sure. So on the home page, it says health coverage starts here. That here button will take you to a worksheet, and on one side you'll have your medical coverage that you can fill in the spots, and then on the other column would be more of the alternatives. And there are different flavors of the alternatives, but you can quickly see using that worksheet, what a major medical event would cost, and then what your annual, either whether you're making a contribution or a premium payment, what are you paying just for that plan, and can you afford it?
That's where you're going to be able to offer your expertise when someone reaches out.
Exactly. And then we can also play around with numbers. So for example, if you are thinking about retiring, you're working with a financial advisor, they become really key in what are your distributions, or let's control your income to be a certain level. And then we can count on that premium tax credit for the next couple of years. So they can become real valuable in designing an income stream that will affect the premium tax credit you'd be receiving for medical coverage if that's something that you need. That's another way to kind of control, if you have that luxury, to be able to control your income.
Thank you so much for joining us today.
Thank you, Lisa. I appreciate your time. I appreciate all of those people that do podcasts and share the experiences and knowledge of others. And I really appreciate what you do. And for anyone out there that would like to do what I do or would like to talk, I would love to know you. And I wish you all very well and a very good health.
Well, that wraps up the conversation today with Amy Nielsen. I hope you're walking away with insight and inspiration from Amy's journey and the work that she's doing to support individuals and small businesses. If you want to learn more, head over to Amy's website, lifestyle-advisors.com. As always, thank you for tuning in, and I'll catch you next time.
I hope you enjoyed this episode of Time for You for Female Entrepreneurs. If you loved this episode as much as I did, head on over and rate and subscribe so you never miss an episode. New episodes drop every week, and if you want to support the show, leaving a review goes a long way. A special shout out to our amazing partners and sponsors. Their support allows us to continue bringing you engaging content every week. And with that, a big thank you. I look forward to seeing you next time. If you're ready to supercharge your email marketing and automation game, look no further than my favorite autoresponder, Active Campaign. It's the ultimate all-in-one platform designed to turn your contacts into customers and your customers into loyal advocates. Imagine having a tool that not only understands your customers, but anticipates their needs. That's what Active Campaign does. With its powerful customer experience automation, you can create personalized journeys that nurture leads, drive sales, and build lasting relationships. The biggest reason I chose Active Campaign after trying other autoresponders is because I wanted to make sure my emails were being delivered and not going into spam. I need to know that my emails actually get to the people I'm emailing so that I have good engagement rates, response rates, and click-through rates on every email I create. Then I can have peace of mind that what I send out about my blog posts or upcoming events gets delivered and that people get to read what I write. And since it's just me, using Active Campaign saves me a bunch of time because I've been setting up automations that I can just drag and drop, allowing me to save hours of time. Not only have their pre-built automations and integrations saved me time, I'm able to power a personalized marketing plan throughout the customer's life cycle. In the end, I really want to personalize my message and make sure that each person is getting a unique email tailored to them, because I don't want to be sending bulk cookie cutter emails. I want to make sure that my customers and community is getting things that are tailored to them as much as I can. Email marketing doesn't have to be crazy where you're not just pushing information. ActiveCampaign teaches you how to be pulling information as well. I appreciate the value I've received from ActiveCampaign when it comes to creating and managing email campaigns. The support through webinars, live chats, and live study halls have been very helpful in maximizing their platform and a great alternative to those other email services I've tried in the past. ActiveCampaign allows me to build a business without relying on advertising. It has simplified my marketing processes, saving me time, which allows me to focus on what I do best, serving my customers. Whether you're a small business or just starting or a seasoned entrepreneur, ActiveCampaign scales to meet your needs and grows with you. If you're ready to up your marketing game, go to my website, lisarcarmichael.com/ActiveCampaign. That's my partner link, and sign up for a free trial. Experience firsthand the power of ActiveCampaign and take your marketing to a new level. Don't miss out. Stay ahead and stay automated with ActiveCampaign. Go to lisarcarmichael.com/ActiveCampaign for your free trial. Hi friends. Today let's have a heart-to-heart about something that's been a significant part of my life, skincare. As a busy female entrepreneur, I need a skincare routine that's quick, easy, and super effective. Turning 60 didn't bother me because I've been taking care of my skin every day for 20 plus years. I didn't always, but I'm glad I did start when I did. Let's fast forward to 1 year ago, and let me tell you about a game changer for me. I stumbled across my secret weapon, Droplette. Droplette is not your typical skincare company. It's a revolutionary approach that delivers personalized monthly skincare subscriptions tailored to your specific skin type. The magic lies in the Droplette Micro Infuser, a device that creates microscopic droplets from formulated capsules, expelling them at a high velocity to infuse ultra-concentrated active ingredients deep into your skin. Now, I'm a self-proclaimed skincare junkie. I've tried it all, from serums to spa treatments, and even once selling a natural body care line. So when I heard about Droplette, I knew I had to give it a shot. I can confidently say it's made a remarkable difference in my skin and my routine. The Droplette Skincare Micro Mist Infusing Device is a game changer. It uses a gentle mist to penetrate ingredients 20 times deeper through micro mist technology. It works with formulated capsules similar to an espresso machine, allowing you to infuse the treatments that are right for you into, not just onto, your skin. Here's how Droplette works. Choose your serum, collagen, retinol, glycolic acid, or maybe a lip plumper. Insert the capsule, hold the device to your face, and press the button. A fine mist of the serum is released onto your skin, targeting your face, your neck, chest, anywhere you want to focus on. These misting capsules have transformed my skincare routine. The results are incredible, from increased resilience to fading hyperpigmentation. Why do I love Droplette? It's quick, easy, and the capsules are recyclable. No cleanup, no hassle. And here's the bonus. Droplette's formulas are clinical strength, dermatologist recommended, cruelty-free, sulfate-free, paraben-free, gluten-free, soy-free, fragrance-free, and vegan-free. It's a skincare lover's dream. If you're looking to level up your skincare routine and evolve beyond the basics, Droplette is your answer. Plus, they offer free skin consultations with their estheticians to address your skin concerns. Investing in a good skincare routine and self-care is crucial for any woman, especially us busy entrepreneurs. First impressions matter, and you want to put your best face forward. It's time to evolve and embrace the next level of skincare. Head over to the Droplette link on my website today where you can start your own personalized Droplette routine. Here's to glowing, radiant, and fiercely beautiful you, no matter what age you are. Go to lisarcarmichael.com/droplet.